Good morning and welcome. We're discussing the signs of infertility in the woman. I want to be more dynamic in this video because I am actually standing and discussing in the classroom. Now, why is a woman finding it difficult getting pregnant? If you are mature sexually, if you are in a sexual relationship, if you are married, or you have been having regular sexual intercourse, regular means like 2 to 3 times weekly, and you have gone for a year or more, and there is no pregnancy, then you might be suffering from infertility. We will not refer to it as infertility if you have not actually been having unprotected sex regularly for at least 1 year. So we explained, you understand what we are talking about. Ladies and gentlemen, reasons why a woman will find it difficult to get pregnant. We must understand also that some of the women may not have any sign or symptom to show. Some of them are asymptomatic, meaning no sign. They look very healthy, they look very smart, they are good in bed, okay? You can look at them and say that now this is a woman in all the facets, yet she is finding it difficult getting pregnant. Now, we are going to discuss some of the predisposing factors. What are those conditions that predispose a woman to infertility? Then we shall continue with the signs and symptoms of infertility in the woman. The signs that will show that the woman is finding it difficult getting pregnant. Now, let's go with the predisposing factors. 1, age. We know that infertility increases with age, especially when a lady is from 35 years to 40 years and then going. The fertility rate begins to reduce. And they begin to find they begin to find it difficult getting pregnant. Okay. Now, apart from age, there is menopause. That a lady might have already reached menopause without knowing that she has reached menopause. Means possibility of releasing an egg is no more there. All the primordial follicles in her ovaries are finished, so she can no more reproduce. Then she needs to know that she has reached menopause, and all the signs of menopause would have been showing. We will discuss that in another topic. Number 3, that menopause was number 3. Number 4, other underlying causes, okay, like untreated sexually transmissible infections, like chlamydia, like syphilis. A lot of people even treat it, and it is not completely treated. A lot of people treat them wrongly. A lot of people did not even diagnose, did not even know about it, and then it stays in your system and eating you up and leads with complications. And one of such complications is, one main complication is a pelvic inflammatory disease. When a woman is suffering from a pelvic inflammatory disease, it sometimes may be difficult for her to get pregnant. Now, number 5, a pelvic inflammatory disease can now easily lead to blockage of tube. Number 5 is blockage of tube. Some women have their fallopian tubes blocked, so they need to always go to the hospital, see their doctors, so that details of this are sorted out. If they discover that your tubes are blocked, they can determine the kind of blockage and see how they can open it. Yes, it can be opened. If they discover that your tubes are blocked, it can be opened. A hydrotubation can be done. Like some people will just describe that they blow the tube. Yes, it is possible. Let them discover that. They can do what they call a hysterosalpingography to find out or confirm if your tubes are blocked. Now, number 6, irregular menses. When you begin to have your menses become very irregular, such that you don't even know how to count the number of days. This month it is 30-day cycle, and next month it is now 20-day cycle. Before you know it is now 35-day cycle, and so on. It's getting very irregular. These are signs. So I'm going to present some signs now and symptoms that a woman is not fertile. Those signs that a woman is infertile, or those signs that will show that the woman will find it difficult getting pregnant. Number 7, painful or heavy menses. This is what some women face. When you notice that menses become painful, or you notice that menses become heavier, some are coming with clots, some no, they become slimy, they become slippery, some have odor. When you notice incoherence, inconvenience, and discomfort with menstrual flow, it is a reason for you to go to the hospital and see your doctor. Number 8, no periods at all. Some people will go for some months without menses. Go and complain in the hospital. See your doctor. Even though sometimes stress, some trouble in the mind may cause your menses to skip for 1 or 2 months, but when it becomes regular, it's a sign of a problem. Number 9, hormonal imbalance. It can see the sign from low libido. Some women will completely lose the feeling for sexual intercourse. They lose sexual feeling. The desire for sex completely drops, and they don't even mind anything again about it. Then we need to see it as signs of a problem. Number 10, growth in the womb, like fibroid, uterine fibroids. They could completely occupy the womb and block and prevent possibility of getting pregnancy. But I would like to add, if they tell you that you have uterine fibroids, it is not a death warrant. Please, let your doctor follow up. They can be removed. They can be treated. They can be managed to give you possibility of getting pregnant. Now, number 11, hyperprolactinemia. When we say hyperprolactinemia, it means a situation where the level of prolactin in blood is high. This will prevent ovulation. Any person that has this kind of situation will not ovulate. Because, my dear brothers, this will block the pituitary gland from secreting follicle-stimulating hormone, and your ovaries will go dormant. And sometimes the signs in this case is that the woman's breast will be flowing. You see, a woman has her milk coming out from her breast as if she's breastfeeding a baby. Yes, when you see this, let it be a cause for alarm, because you may be suffering from hyperprolactinemia. Prolactin is that hormone that causes breast milk to secrete when a woman gives birth. But some women are finding it difficult to get pregnant, yet they see when they just press their breast, they just express it, milk is flowing. It is a question mark. Number 12, brain tumor. There may be a growth in your brain, right at the pituitary gland even, that may alter the functioning, and it may not produce the hormones at the right time. Follicle-stimulating hormone may not be produced. Number 13, blocked cervix. Do we know that some women have sex, and whatever a man has ejaculated flows out? It flows out as soon as the woman is getting up. And sometimes the problem may only be at the level of the cervix, that the cervical canal is completely blocked. They can use a uterine sound to test this, just to pass, and you may confirm that there is a blocked cervix there. Number 14, ovarian cyst. Typical situation where an abnormal growth grows on your ovary. And sometimes there are many of them, like what we call polycystic ovarian syndrome. this may actually make it very difficult for a woman to get pregnant. Number 15, an ovulatory period. A woman is not ovulating at all. And the check, you may be using even laboratory tests or strips to be testing your ovulation. And you end up confirming that you do not ovulate. And your doctor may verify and will confirm that some months go by without you ovulating, and they may have to dig out the causes of absence of ovulation so that they treat it. Then we'll know about endometritis, number 16. Endometritis. You find a kind of tissue which is supposed to be in the womb of a woman. Such tissue are now found in the fallopian tubes. They are found in other areas. It is wrong. It is wrong. The woman in most cases is going to find it very difficult getting pregnant because adhesions in most cases will form, preventing movement of sperm or fertilized egg. And it makes it difficult for the woman to be able to get pregnant. Now, hyperthyroidism. The thyroid gland may be over-functioning or may not even be producing enough of the thyroxine, and all this function is going to lead to infertility. Number 18, a hostile vaginal temperature. Well, this one, sometimes some ladies just get hot. The temperature around the vagina increases more than 35. 37.5. You see, it increases up to 37.3, 37.5, getting even to 38 degrees. Sometimes just by sexual stimulation, just by sexual act, temperature inside there increases. Such a woman will find it difficult getting pregnant because sperm cells that come into the vagina, that high temperature will weaken them, and no weak sperm can fertilize a woman. Number 19, unexplained infertility. They can check in the hospital. All kind of experts may see her and notice that the womb is fine, the fallopian tubes are good, the ovaries are producing, even the man, and so on. Yet a woman doesn't get pregnant. We'll just say unexplained infertility. Number 20, thin decidual lining. Before implantation takes place in a woman, there is a lining that forms inside the uterus. If that lining is too thin, that is, it is not thick, a fertilized egg may reach there and cannot fertilize. It's like you pick your seeds, maize or beans, and you're planting on a rock, or you just pick a small piece of soil and spread on top of a stone and then put it there. It will not grow. It may germinate but cannot grow. So sometimes some ladies will have implantation, is struggling to implant, 2-3 days passes, and then she finds it very difficult. There might be a problem with the level of hormones like estrogens and progesterones. Let your doctors follow you up. Now, number 21. Sometimes I always like to say witchcraft. Yes, because I am African and I know what it takes when people ignore their role as far as the culture and tradition of the people is concerned. I know what it takes when people ignore the fact that there is spirituality and that people can bewitch you and that somebody could curse you and a curse could trust you. Don't know why nothing is working. Yet if you sit down, you may seek the help of spiritualists and your problem will still be solved. Last of all, male partner. Check the male partner. Who are you looking for pregnancy with? Is he having healthy sperms? Is he able to supply the healthy sperms? Is there a problem with him? If all of this is checked, then a woman can easily discover the reason why she is not getting pregnant. Your doctors will solve these problems in the hospital. Subscribe to this channel. My name is Dr. David Ayim, your reproductive health expert. Thank you.